You have a chance to know all about current health issues, upcoming projects, and how the health department plans to continue improving public health and safety in Lucas County. And Health Commissioner Kareem Baroudi is here with us to explain. So you're taking the old meetings on the road, are you?
Yes, we are. I think Lucas County and Toledo are very engaged community. We want to take it out to them. We want to get them engaged into the public health again. And that's why I think the board decided we want to go into the community where we're serving, be close to them, and hear what they need when it comes to help.
So you've been on the job with this role 5 months, but yet you've worked for the health department in past years. You've been in that line of work for a long time. Looking back on the experience of COVID, what did we learn? I think not just about this happening. It was like every 100 years something like this happens. It seems like, but what did we learn about how we reacted and how the governmental people acted?
Sure. Well, the lessons from COVID we're still drawing, out of COVID and learning from COVID. What we learned is for community to work together, to come close. We had a threat of COVID that happened, hopefully every 100 years or so. That threat brought us together. On the other hand, we did see some challenges with COVID, people not trusting the government, trusting what public health, measures we put in place. All that stuff, I think we learned from it as public health. We learned how to reach out to people, to engage people in their own health. And that's part of the vision moving forward for our board to just, okay, we want to engage people. We want to explain to people the why. The more we can explain about the why, the more we can explain to them how it's affecting their health, their daily lives. I think we'll get more buy-in into them doing the right thing and changing some behaviors.
I think what I really learned about it was how herd immunity wasn't just a term, but something that we all saw in real time as more of us were exposed. Some got it, some did not. Some were kind of naturally less likely to get it. And in time, it's been kind of where it's still there, but it's not nearly the panic mode that we were 2-3 years ago.
You're absolutely right. We learned a lot about science, and science became a household items where herd immunity. Herd immunity is a very important concept in public health, and that's why we've been immunizing children for so long when they go to school, to give a chance for the people who cannot be immunized for reasons, for good reasons, to be protected from, disease that will circulate throughout the community until it finds a weakest point, and then we'll get there.
And I think what we learned too is that we need to be exposed to some germs. It's not good to isolate yourself from everything, because you need to be exposed to where your body gives a chance to put up those barriers, keep you from getting sicker.
Well, and that's the concept of the vaccine. It will expose you to that germ, it will trigger your immune system, and it will give you protection. So that's the same concept.
Okay, so the health department's going on the road, and I think being open, transparent government agency is a good thing. Can you tell us what the health department is doing on a daily basis now? What are their normal activities now that we're past the big crisis?
Oh my gosh, that will take your whole hour. We have 100+ programs that goes out of our building. Our staff of 123 people, they go out every day and change lives every day. We touch so many lives on so many ways. We do food restaurant inspections, we do grocery store inspections, water wells, sewage, we do have car seats, we do vaccination clinics, we do have a wellness, we do have awake clinics. We do have a whole bunch of stuff that touches our lives every day. That's the best kept secret, though. Not a lot of people know, and that's why engaging the community in their own health, I think, will give us that chance to let them know.
I had forgotten that the health department is the one that does the inspections of all the restaurants. Now, is that something that's set up on a regular basis? So, like, I'm going to come to your restaurant every 4 months, 5 months, 6 months? How does that work out?
Well, that's risk-based. So depending on how much cooking I'm doing in a restaurant, in a kitchen, how much involved my cooking, is that process cooking? We visit you more often than your gas stations where we're selling prepackaged stuff. But all food that's being sold to the public, served to the public, is subject to compliance checks by public health here locally.
So I want to mention before we go, we've got the on the road monthly meetings. They'll be coming up in later September, City of Waterville. That's the meeting? There you
That's
go.
later this
Waterville,
week.
later this week, and
That's
October
later.
4th in Sylvania Township.
That is correct. And we invite the public, again, to engage with their Board of Health. We've met with the mayors, with the public officials in those communities, and they have some good requests for us and some good pointers on how to engage people.
Kim, great to meet you.
Excellent. Thank you.
Appreciate it.